Children are directly in the crosshairs of the myopia epidemic, but working with them presents its own challenges. From dealing with parents to treatment compliance and objection coming from all sides, it is not an easy task to maximize myopia patient outcomes. So I'm Dr. or Professor Dominique Bray-Monchignac, and I'm here to help you address these common patients' issues. We will go over dealing with these factors that can cause myopia, mayhem, and more. Sometimes parents don't know about the risk of myopia, and so you have to explain that first. Second point, you have to make the diagnosis and to explain there is myopia that could be progressing, and so we have to have myopia control. When you explain, they can understand that it is efficient. So the cost is probably the major concern. We have that every day because they say, okay, are you sure it's efficient? But the problem is the cost, and so you can propose atropine because atropine for us in France is low cost. But after that, I explain also that defocus glasses is efficient. And if you explain that the defocus glasses will be changed less, so it will be less cost. And the second point is compliance. Also, for instance, that if it's low-dose atropine, you need to explain that should be done every day and not every 1 day a week. The communication is very important. So, of course, when you have the parents and the child with the myopia, you can explain everything. But also, we did conduct a myopia control campaign in France to explain to all the population there is a problem. So we have 1 week a year to have a myopia control campaign. And so I think it's very important because we conducted a survey and we understood that there is very little information known by the parents about myopia. The strategy is to explain the complications. And so that's very important to explain that first there is quality of life for the child, but after that there is so bad complication that could lead to blindness. And so they can understand that. You need to convince the child. Because if you don't convince the child, there will be no effect. And so that's the point. So when you talk to the parents, you talk to the child, and also you customize the solution. Because it depends, some children will not accept eye drops, but others will just let the glasses just out. So you need to evaluate that. And so with that, you will have succeed for that treatment.